Thank you for staying with us for our hour-long special, Silence the Stigma, addressing the mental health crisis in South Central Pennsylvania. We're taking this hour to talk openly and honestly about the biggest issues currently affecting our area and ways we can offer support to help end the stigma that's associated with mental health issues. Experts say overcoming addiction became an even bigger challenge throughout the pandemic, with the Centers for Disease Control and Prevention reporting a concerning rise in opioid-related overdoses. We asked our expert roundtable about how to offer support to loved ones who may be suffering from an addiction or substance use disorder.
This has been a really difficult year for everyone. And we've seen even further increased issues with drugs and alcohol. If we know someone is having these problems, these issues, is there a correct way to approach them? And if so, what can you say to them so that they know that you're there and they know that you care, but you don't want to push them away?
I think the first thing to remind yourself is that this is not this person's fault. It's not as clear-cut of a choice. Addiction is not a choice that they're making, and that there's almost always something underlying the substance-related disorder. There's probably a mental health problem or illness of some kind, and there's very often trauma that's informing the need to escape via substances. And when you put it like that, you look at the last year, or more than a year now, and who hasn't experienced a significant amount of trauma? You know, when you're trapped inside, substances are available to you, and you don't have the other ways that you used to cope. We take for granted that so many of us used to cope more or less accidentally. Going into the office and saying hello to our colleagues was filling up our need for social connection. Being able to go to the gym or go to the mall or whatever it is that you do for self-care, so much of that has been taken away, and many of us have started to realize that we didn't have internal coping mechanisms when all that stuff was pulled away.
I think approaching the person in a non-judgmental and supportive manner is the best way to go, and assist finding this person medical treatment, because we can help substance use disorders. And I think it's important not to assume that the person wants to stop using, but instead try and explore, why they're using, what else is going on.
Be curious, not judgmental. Be curious with them, saying and starting off sentence like, I wonder if you're struggling at work. I've been seeing you drinking a lot. Think those sort of things, not you're drinking a lot, but be curious. As Mark said, there's probably something else going on underneath, and chances are they're doing the best that they can, and they're going to need your help.